Anxiety disorders are among the most common mental health conditions, affecting millions of people worldwide. Despite the prevalence of anxiety disorders, many people may not fully understand the different types of anxiety disorders and how they can impact daily life. In this video, we will explore 10 helpful pieces of information about understanding the various types of anxiety disorders, including generalized anxiety disorder, panic disorder, social anxiety disorder, obsessive-compulsive disorder, post-traumatic stress disorder, specific phobias, separation anxiety disorder, agoraphobia, adjustment disorder, and general anxiety. By learning about these different types of anxiety disorders, we can increase our understanding of the challenges faced by those who live with anxiety disorders, as well as the various treatment options that may be available to them. Whether you are someone who lives with an anxiety disorder or simply want to learn more about these common mental health conditions, we hope this video will provide you with valuable insights and information. 1. Generalized Anxiety Disorder, GAD. Generalized Anxiety Disorder, GAD, is a mental health condition that affects millions of people worldwide. It is characterized by excessive and persistent worry about various everyday events and activities, even when there is little or no reason to worry. People with GAD often feel tense, restless, and irritable, and they may experience physical symptoms such as muscle tension, fatigue, and trouble sleeping. These symptoms can significantly impact daily life and may interfere with work, school, and social activities. Fortunately, effective treatments such as therapy and medication are available for managing GAD symptoms and improving overall well-being. 2. Panic disorder. Panic disorder is a type of anxiety disorder characterized by sudden and unexpected panic attacks. These attacks are intense periods of fear and discomfort that may last a few minutes to an hour, and can include symptoms such as sweating, rapid heart rate, shortness of breath, chest pain, and a sense of impending doom or danger. Panic attacks can occur without warning and may lead people to avoid situations that they fear may trigger an attack, such as public transportation or crowded spaces. Panic disorder can be very disruptive to daily life, but there are effective treatments available such as cognitive behavioral therapy, medication, and relaxation techniques to help manage symptoms and improve overall well-being. 3. Social anxiety disorder. Social anxiety disorder, also known as social phobia, is a type of anxiety disorder characterized by an intense fear of social situations or performance situations in which the person feels they may be judged or scrutinized. People with social anxiety disorder may avoid social situations altogether or endure them with great distress. They may fear being humiliated, judged, or rejected by others, and their fear can be so severe that it can interfere with their daily life, relationships, and work or school performance. Fortunately, effective treatments such as cognitive behavioral therapy, exposure therapy, and medication are available to help manage symptoms and improve overall well-being. 4. Obsessive-Compulsive Disorder, OCD. Obsessive-Compulsive Disorder, OCD, is a type of anxiety disorder characterized by persistent, intrusive, and unwanted thoughts or images, obsessions, that cause anxiety, as well as repetitive behaviors or mental acts, compulsions, that are performed to reduce the anxiety. OCD can be very time-consuming and can interfere with daily life, relationships, and work or school performance. People with OCD may feel like they are trapped in a cycle of compulsive behaviors that they cannot control, and the anxiety caused by their obsessions can be overwhelming. Fortunately, effective treatments such as cognitive behavioral therapy, exposure therapy, and medication are available to help manage symptoms and improve overall well-being. 5. Post-traumatic stress disorder, PTSD. Post-traumatic stress disorder, PTSD, is a type of anxiety disorder that can develop after a person experiences or witnesses a traumatic event, such as combat, natural disaster, or assault. Symptoms of PTSD can include intrusive thoughts or memories of the traumatic event, avoidance of triggers that remind the person of the event, and hyperarousal or heightened sensitivity to potential threats. People with PTSD may also experience negative changes in mood and cognition, such as difficulty concentrating or feeling detached from others. PTSD can be very distressing and can significantly impact daily life, relationships, and work or school performance. Fortunately, effective treatments such as therapy and medication are available to help manage symptoms and improve overall well-being. 6. Specific phobias. Specific phobias are a type of anxiety disorder characterized by an intense and irrational fear of a specific object or situation, such as heights, spiders, or flying. People with specific phobias may experience extreme anxiety, panic attacks, or even physical symptoms such as sweating, shaking, or heart palpitations when faced with a feared object or situation. They may also go to great lengths to avoid the feared object or situation, even if it means disrupting their daily life, relationships, or work or school performance. Fortunately, effective treatments such as exposure therapy and cognitive behavioral therapy are available to help manage symptoms and improve overall well-being. 7. Separation anxiety disorder. Separation anxiety disorder is a type of anxiety disorder characterized by excessive and persistent fear or anxiety about separation from a loved one or caregiver. This can include anxiety about going to school, work, or other places where the person must be apart from the loved one. People with separation anxiety disorder may experience intense worry or fear that something bad will happen to the loved one or that they will never see them again. They may also experience physical symptoms such as headaches, stomach aches, or nausea when faced with separation. Separation anxiety disorder can significantly impact daily life, relationships, and work or school performance. Fortunately, effective treatments such as cognitive behavioral therapy and medication are available to help manage symptoms and improve overall well-being. 8. Agoraphobia. Agoraphobia is a type of anxiety disorder characterized by an intense fear of being in situations or places from which escape might be difficult or embarrassing, or where help might not be available in the event of a panic attack. People with agoraphobia may avoid leaving their home or other safe places, and they may have difficulty engaging in everyday activities such as shopping, traveling, or socializing. Agoraphobia can significantly impact daily life, relationships, and work or school performance. Fortunately, effective treatments such as exposure therapy, cognitive behavioral therapy, and medication are available to help manage symptoms and improve overall well-being. 9. Adjustment disorder. Adjustment disorder is a type of stress-related mental health condition that involves a significant emotional reaction to a stressful life event, such as a divorce, job loss, or illness. Unlike other anxiety disorders, adjustment disorder is triggered by a specific stressor and the symptoms generally resolve once the stressor has been addressed. Symptoms can include anxiety, sadness, difficulty coping with daily life, and changes in mood, behavior, or physical health. Although adjustment disorder can be distressing, it is generally a short-term condition and can often be managed with support from family, friends, or mental health professionals. 10. General anxiety. Generalized anxiety, GAD, is a type of anxiety disorder, which is characterized by chronic and excessive worry and fear that is not necessarily tied to any specific event or situation. People with GAD may feel anxious and worried about a wide range of things such as health, family, finances, or work, but they may not meet the criteria for a specific anxiety disorder. They may also experience physical symptoms such as restlessness, fatigue, and trouble sleeping. Generalized anxiety can significantly impact daily life, relationships, and work or school performance. Fortunately, effective treatments such as cognitive behavioral therapy and medication are available to help manage symptoms and improve overall well-being. In conclusion, understanding the different types of anxiety disorders is crucial for anyone who wants to learn more about mental health and support those who are struggling with anxiety. By recognizing the symptoms and seeking help when needed, individuals with anxiety disorders can live fulfilling and meaningful lives. If you or someone you know is experiencing symptoms of an anxiety disorder, it is important to seek professional help from a licensed mental health provider. There are a variety of effective treatments available, including medication, therapy, and self-care strategies that can help manage anxiety symptoms and improve overall well-being. We hope this video has provided you with helpful information about anxiety disorders and has inspired you to learn more about mental health. Remember, you are not alone, and there is help available. Thank you for watching, and we wish you all the best on your mental health journey.